So I started working with the American Society of Echocardiography on the guidelines in 2009. We had a first iteration of the guidelines. It was a large group that included authors from the United States as well as from Europe. We then had a second update in 2016 with new developments, with new indices of diastolic function, and with the need to pay more attention to age changes in diastolic function parameters. The 2025 guidelines working group was assembled. I'm Sherif Nagueh, the Medical Director of the Echocardiography Laboratory at Methodist DeBakey Heart and Vascular Center in Houston, Texas. As a chair, you assemble the data, you discuss with the different working group members their point of views and opinions, use data that is, or recommendations that are well supported by evidence. So you play a good role in bringing the different opinions together to a consensus, and you try to also test it before you make the recommendations, so you know the accuracy of these recommendations. So the major recommendations, one is paying attention to age-induced changes in the diastolic function parameters that we rely on to diagnose disease. Another major difference is a new algorithm for estimating left atrial pressure, which was tested in a large study with 951 patients. And a third major difference from previous guidelines is the inclusion of recommendations of how to use imaging, particularly echocardiography, in reaching a diagnosis of a common disease, heart failure with preserved ejection fraction. They are important because they, first of all, identify patients with disease and at the same time avoid labeling someone without disease as disease. Once someone is identified as having disease, prevention measures and potentially treatment measures can be directed to deliver best care for these patients.